Afaf Meleis, and I'm the Dean of School of Nursing at the University of Pennsylvania, and I want to talk about the book, Women's Health and the World's Cities. And the urbanization is upon us. We have now half the world is urbanized, and by the year 2030, 2/3 of the world will be urbanized. Urbanization is great. It brings modernization, it brings job opportunities, economic development, and it brings things that a reason for people to move into urban areas. However, urbanization also have many challenges. What's happening is that as we look at urbanization, there is also increasing poverty as people move more into urban areas. So there are 32% of urban areas around the world are poor areas and high poverty areas. And about 70 to 80% of the population who live in those poor areas are women. So women are, as they move into urban areas, urbanization increases the risks for violence, the risks for illness, the risks for infection, the risks for isolation. And that is what this book is about. This book is about brought together scholars and community activists from around the world who are interested in different aspects of urbanization and different aspects in women's health. The book is about the interrelationship between design, between urban development, and women's health. So what one gets out of reading this book are several things. One, we cannot really think about urbanization and developing urban areas without hearing women's perspectives, their needs, their interests, and how they can be kept themselves and the families safe. We also see in this book that this is such a complex area that it cannot be solved by one discipline. Therefore, we have the designers, the architects, the urban developers, the economic developers, the epidemiologists, the nurses, and the physicians. Ideas, and it's that interprofessionalism and that interdisciplinarity that's going to be helpful in designing urban areas that are fit for women, but it's also urban areas that are driven by the needs of women, and that which can make it a better urban areas for everybody. This is a book that we have written with this amazing collection of scientists and scholars and clinicians and artists, to be read by teachers, to be read by researchers who are looking for gaps in knowledge that need to be developed, and for policymakers. I don't think a policymaker or an urban developer can afford to actually work on the development of an urban area without reading the wisdom that's provided in this book by incredible number of theorists and researchers and artists and community workers.